Hello and welcome to Mental Health and Disability. I'm Kimberly Rice. I'm a doctoral student at Arizona State University in the Special Education Leader Scholar community, and I'm here with my fellow doctoral students, Laura Kaur and Rebecca Miller. The goal of our presentation is to analyze the intersections of disability, mental health, and illness, and the ways in which these are distinct yet interrelated. Let's define mental health, chronic disease and illness, and disability. According to the World Health Organization, mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her own community. According to the Center for Disease Control and Prevention, chronic disease is defined on the basis of the biomedical disease classification. It includes diabetes, asthma, and depression, for example. Chronic illness is the personal experience of living with the affliction that often accompanies chronic disease. According to the World Health Organization, a disability is any condition of the body or mind, otherwise known as impairment, that makes it more difficult for the person with the condition to do certain activities, what is also called activity limitation, and interact with the world around them. In other words, participation restrictions. While these definitions are from national and international organizations, within our own educational systems and personal experiences, we may have formed a very different definition of what mental health, chronic illness, and disability consist of. I interviewed a surgeon about the notion of disability, and he told me about a Latin medical term, sequelae, which means things get worse and worse over time. This refers to secondary consequences from disease, for example, depression, that may result from living with a chronic illness or disability. The medical model considers disability from a deficit model. Compare this with the social model of disability. The social model of disability considers disability from the point of view of those with a disability and questions societal barriers to people with disabilities, ranging from buildings to attitudes and mindsets. The three of us this past summer took the course called Critical Disability Theory with Dr. Juliette Hart-Burnett at Arizona State University. And one of the books that we read by Baglieri and Lalvani from 2020 is called Undoing Ableism. And in this course text, the authors referred to the medical model as generalizing all individuals that in which their disability occurs, either physical, cognitive, or sensory impairment needs to be intervened and treated, whereas the social model recognizes that all people have varying abilities, and therefore one's quality of life should not be entirely impacted by those differences, but instead how we as a society respond to one's differences medically, socially, and culturally. So oftentimes within the school system, the medical model of diagnosis and the social model of service delivery conflict as schools struggle to identify appropriate classroom placements and services in response to a given eligibility. We also looked at the World Health Organization International Classification of Functioning, Disability, and Health. According to the ICF, this conceptualizes a person's level of functioning as a dynamic interaction between her or his health conditions, environmental factors, and personal factors. It is a biopsychosocial model of disability based on an integration of the social and medical models of disability. We created a simulation activity about critical disability theory and the mental health disability and impairments that we've talked about so far. This mind map is linked. You can watch, listen, wonder, be inspired, read, hear an explanation, or think and motivate and learn from various resources that we have connected you to using this mind map.
Sadly, mental health in the United States continues to be overlooked and stigmatized. Currently, 76% of youth do not have access to appropriate mental health care. The ratio her professionals in the United States is 6-1, and half of all chronic mental illnesses start by the age of 14. These are startling statistics that should instill a sense of urgency among healthcare institutions, and it demands for a closer examination of the social advantages among the most disenfranchised populations.
When looking at services for disability, chronic illness, and mental health, it's important to consider how the various environments may intersect with each other. When considering the academic setting, when students qualify for services, they often seek support through their direct school, and beyond that, within their school district. School districts across the state rely on the Board of Education to provide supervision and adopt any rules and policies in order to provide appropriate services for students. Within the healthcare system, we often think of the Department of Economic Service or Department of Developmental Disability, and they provide supports and services for eligible persons and provide services based on the diagnosis that they receive. And when considering social services, we often think of the Department of Health Services. Again, they're responsible for a number of programs, as well as providing licensing and regulation for healthcare and child care facilities. When we think about all of these services combined, they are meant to help identify and provide supports for individuals with mental health, chronic illness, and disability. However, many times there's a lack of understanding, one's own perception, or lack of communication and collaboration between and among professionals within these environments and the individuals and or families that require these services. And this can often result in inequity of services or support. When reviewing this topic, we decided to reach out to a school psychologist as well as a school counselor to get more feedback on their perceptions of their roles within the school system. Often, there was a universal response. In order to receive funding within their school system, they must rely on the medical model, which again focuses on an individual's deficits, despite the negative or stigmatizing label it might assign to them. The categorical system of the medical model was developed as a means of not only identifying and meeting the needs of persons with a disability, but also as a way of allocating federal funds. Again, one must ask, are we really saving money this way? Just a few of the negative effects or connotations that can be related to providing services solely based on a medical model can involve a link between teacher training and programs that are provided tied to categorical labels alone, a large variability in categorical differences among and within states. Automatic assumptions of disability category means placing students in certain environments that may be more restricting, such as self-contained classrooms. Also, children who do not qualify but still experience academic and behavioral needs in which they do not receive the supports they need. Mislabeling and or overrepresentation from racial and ethnic minority groups. And again, the stigmatizing and dehumanizing effect of labeling children with a disability. So again, how do we change? To take a closer look at when services and professionals do not align, you can take a look at this video clip. This is an example of a young child who has a diagnosis of autism, deafness, and speech-language impairment. In order to seek services from the state, they sought out to get support for their daughter. But ultimately, the adoptive parents were found guilty of neglect. This is such a sad case, but happens more often than not. Rather than individuals or families gaining the ability or access for proper medical and behavioral health services, we see a disparity or a misalignment with services or professionals having a wide range of knowledge to better support families with varying disabilities, mental health, and chronic health illnesses. So how can we ensure easier and better access for behavioral health care?
The framework for social determinants of health was developed by the World Health Organization, and it's based on the social and environmental conditions in which individuals live. These determinants impact the health and well-being of individuals in certain populations. And so it's important to understand the factors that influence the health of populations. And these factors include age, sex, and genetic makeup, which are also known as triple jeopardy. It includes the health behaviors of individuals, such as smoking, alcohol, and drug use, diet, and physical activity. Another set of variables that impact the well-being of individuals are conditions in which people are born into, grow up, and live in and work in. These conditions are socioeconomic, cultural, and environmental. These determinants influence and interact with each other to affect the well-being of populations. Additionally, these determinants have a great impact on the quality and access of healthcare that is available to people, individuals, and certain populations. Healthcare needs, particularly mental health, are increasing among minority groups such as Blacks and Latinos. This short video addresses the lack of healthcare workers qualified to meet the language and cultural needs of specific populations.
The Centers for Disease Control and Prevention have a specific page on the coronavirus disease for people with disabilities, and this is a very useful resource for those of you working in the mental health field. In addition, the Arizona Department of Education has provided COVID-19 guidance and suggestions for school personnel, including a specific page for exceptional student services. We'd like to leave you now with an open-ended question. How do you believe? We would like to leave you with an open-ended question. What do you believe is the intersection between disability, mental health, and illness? And how do you feel these are distinct yet interrelated? Please respond in the chat box.